Pakistan Global Community, fostering unity and peace through music. चलता रहे ये कारवां.
Hello everyone, my name is Teju and you know me better by my SMEAL ID Teju__K. I'm a financial accountant by profession. I live in the US and I am a thyroid cancer and a thyroid disease survivor from the past 10 years. I thank Pakistan Global Community to give me this opportunity to talk to you and educate you about a topic that's very close to my heart and share my personal experience and journey with you about the disease and cancer. January is Thyroid Disease Awareness Month. Hence, Pakistan Global Community has organized this message for all its members and listeners' benefit. So what is a thyroid? A thyroid is a butterfly-shaped gland or an organ that sits right in front of your neck, which is very close to your trachea or the vocal cords. I look at the gland as the body's engine because it is responsible for your physical and for your mental well-being. According to the World Thyroid Organization, 1 in 10 people around the world, rather, I think it's become more common now. So 1 in 5 people around the world are diagnosed with thyroid disorders, and 1 in 3 women are diagnosed every year with thyroid disorders or thyroid diseases. The main 2 types of thyroid disorders that are very common are hypothyroidism and hyperthyroidism. Hypothyroidism, as the name suggests, is hypo. It means that your thyroid gland is functioning lesser than normal. It means that the thyroid thyroxine that your gland produces is a little less than it should deliver to your body to function properly. On the other hand, hyperthyroidism is where your thyroid gland produces more of the thyroxine, which supplies to your body, and you become hyper, which means that you will overthink, or you will have different symptoms. Both ways, either your thyroid, either your hypothyroid or your hyperthyroid, it's not good for your body. Hence, we are here to talk about how to take care of these 2 types of disorders. In addition to hypothyroidism and hyperthyroidism, there are certain thyroid diseases that we need to be aware of. They are called Hashimoto's and Graves'. What is Hashimoto's and what is Graves'? They both are autoimmune diseases that take place, or that they grow when your body is unable to identify that when an infection happens, it's an external threat to the body, or is it your own organ that's an internal threat? And what happens is your body starts attacking your thyroid until it kills it. I would say it is very similar to how a person develops diabetes, because that's an autoimmune disorder too, where your own body starts attacking your pancreas. And when your pancreas starts working lesser and lesser and lesser, that's how you become a diabetic. So these are the main 2 types of disorders. The 2 main types of diseases are Hashimoto's and Graves'. What are your symptoms when you get these types of disorders? The first symptom is you will probably feel very, very, very tired. Or if you're hyperthyroid, you will be very active. You will not be sleeping. You might be very, very active throughout the day, night. You might have a higher heart rate. You might have a slower heart rate. Main symptom is rapid weight gain or rapid weight loss. You might have sleep issues. In women, you might have your cycle issues, where you might skip cycles, or you might have irregular periods. And you might have a lot of breakouts on your face, you might have black patches. So these are very common symptoms to look out for if you have thyroid, if in case you suspect thyroid disorder. Now, the best way to arrest it at a very early stage is to go and meet the doctor once a year, and please make sure that you you force the doctor to do these tests for you for your thyroid well-being, because normally when you go to a doctor, they would just do the normal tests like your CBC and your lipid panels and etc. But now with this growing thyroid disease and disorders, please tell your doctor to perform these following tests. The tests are called TSH, free T4, free T3, thyroid globulin antibodies, and thyroid peroxide antibodies. These 5 tests they complete the thyroid panel, and you have a range for each one of them. For TSH, if it's beyond a certain limit, you are hypothyroid. If it is reaching the lower limit, you are hyperthyroid. Your free T4 should be well within range. Your free T3 should be towards the top end of the range. Thyroglobulin antibodies and TPO must be 0. If you have positive, it means that you have a thyroid disease. If you have higher numbers, it means that your thyroid disease is progressing and you need to take immediate steps to reduce it. A little bit about my journey. In 2015, I was feeling very tired all of a sudden. I was working out in the gym and I passed out. There was another incident when I was at work walking during my lunch, and I passed out. I passed out once at home. So I had 3 back-to-back incidents, which made me go to my new practitioner, and she suggested she run certain tests. She ran thyroid tests, and she did order a ultrasound of my thyroid too, because I had a very huge neck at that time, which I did not even realize. And she also felt my neck, and she felt a lump. So from this, I can tell you that when you go to the doctor, in addition to asking for blood results for blood work, please have them check your thyroid, check your neck thoroughly every year. So we did the ultrasound. The ultrasound obviously showed some abnormalities, and the cancer was confirmed by the biopsy. The only way to get the cancer out was surgery, so I had to get my whole thyroid gland out, followed by radiation. So now I am on a pill through my lifetime, and I go for checkups every year to just confirm that everything is in check. By God's grace, everything is fine until now, so I'm a happy person. So yes, these are the main things you need to look out for when you have a thyroid disease or a thyroid disorder. Apart from following the doctor's guidelines of the medications that you need to take, please do these things at home. 1, please take utmost care of your diet. 2, light to moderate exercise. 3, do not push yourself to do a lot of vigorous exercise if you have a thyroid issue. 4, yoga is the best for any kind of thyroid-related disorders. 5th is meditation. Meditation is very important for any thyroid patient because the stress is the most important reason and factor for any thyroid disease. So please take care of yourself, and because we all love to sing, we need to take extra care of the thyroid because it is very close to our vocal cords. So with this, I again thank Pakistan Global Community for giving me this opportunity to talk about my journey and to educate you about thyroid disease. If you have any comments, if you want to share any success story, please leave a comment. If you want to ask any questions, please ask on the comments, and I would be happy to help you. Thank you again, and have a wonderful life. Bye-bye.